everyone. Let us give thanks to Almighty God for by His grace and blessings we are able to gather virtually today for this guest lecture organized by the Faculty of Veterinary Medicine, Universitas Airlangga. With the theme of Introduction of Cytology, does it matter in clinical practitioner? Okay, so before we begin, let me introduce myself. My name is Amshad bin Abdul Qadir, and I'll be your MC for today's event, accompanying you throughout the session. So thank you so much to all of the participants who have joined this morning. So we truly hope that today's lecture will broaden our knowledge and understanding of clinical cytology. So to officially start our event this morning, let's together sing our national anthem, Indonesia Raya, followed by Hymne Airlangga.
Sana
Okay, next, please allow me to introduce our amazing speaker for today. Our speaker for today is Dr. Stephen Taufik Leo, a certified veterinary acupuncturist with extensive experience in veterinary clinical practice and animal therapy. So before we start, let me greet our speaker first. Okay, so good afternoon, doctor. How are you today?
Hi, good afternoon. I'm good. So,
So, okay, so to share your knowledge and experiences with all of our participants.
sure. So I'm gonna try to share my presentation.
Eh,
We,
Hi,
Can
Dr.
you
Stephen.
see my presentation?
uh,
Hi, Doc.
Hi, Dr. Stephen.
Hi. Can you see
Hi.
my
Yeah,
presentation?
I'll be your moderator today.
Sure.
So, yeah, greetings to all the participants who have joined us this morning. I'm
Mhm.
sorry, this afternoon. Sorry, this 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 afternoon. Yeah. Um. Uh. Today guest lecture. Yeah, will entitled Introduction of Cytology. Does it matter in clinical practitioner? Yeah. We are delighted to welcome Dr. Stephen Taufik Leo, CFA. Yeah. Hello, how are you, doctor?
Hi, I'm good, Doc. How about you?
He is actually 1 year senior back then in the faculty, my senior. Yeah. I remembered back then Dr. Steven is the good example of entrepreneur students. Yeah. Entrepreneur student. He sell almost everything like books, surgery, and
Thank
practical
you.
stuff. Yeah. And also snacks and food. Yeah. So yeah, okay. Um, Allow me to read a brief curriculum vitae first
Mhm.
of Dr. Stephen.
Sure.
Okay. Please, maybe Amshar can help me to
Wait a moment.
present the CV.
Okay, I'm gonna close my share screen first. I'm gonna
Yeah.
stop my share screen first.
Okay. Thank you, Dr. Stephen. Okay. Okay. So, okay. As you can see, Dr. Stephen Taufik Leo, CFA, is the small animal veterinarian based in Bali with advanced interest on oncology, cytology, acupuncture, and clinical pathology. Over 10 years in practice, yeah, including senior clinical role at Sunset Vet Animal Hospital, yeah, and then certified in veterinary acupuncture or CFA from Chi Institute, yeah, Chi University, and got the DVM and Bachelor of Veterinary Medicine from Universitas Airlangga, yeah. Uh, the prior roles include an assistant lecturer, histology, and clinical exposure at Kasestart University Veterinary Teaching Hospital. Active in continuous education, yeah, like ESAVS oncology course, short training at Chulalongkorn Animal Hospitology, and then also publish multiple case report from, for example, hemangiosarcoma palliation, diabetic ketoacidosis, electroacupuncture, and frequent speaker for industry and academic events. And the language, Indonesian as native language, and then English and Mandarin, yeah, active listening and speaking. For core skills, yeah, Dr. Stephen Leo skills are acupuncture for small animals like horse, alpaca also. And then cytology, soft tissue and orthopedic basics, chemotherapy, and blood transfusion. Okay, now without further ado, are you ready, Dr. Steven?
Yes, I am.
Okay, doctor, you can start your presentation for 60 minutes and then we will open Q&A sessions in the end of your presentation.
Okay, thank you, Dr. Taya. So
You're welcome.
please help me to interrupt if my voice is not clear, yeah. So good evening, everyone, for the for my friend in university and then like for my colleague. So today I'm gonna discuss for cytology, does it matter in clinical practitioner? So literally like the things that we have the issue right now, like every time that we have clients who come to us and then like, okay, let's say we have a bump and a lump. And then what is the next step? Because like, okay, let's say if you want to remove it and then wait from the pathologist, usually the pathologist in, as I know in Indonesia and in Malaysia also, like it takes like 2 until 3 weeks in order to get the result. But
Recording in progress.
by at least by doing FNA, fine needle aspiration, it's just like non-invasive and then like it's cheap. You just sneak your needle and then like check under the microscope. You just put the stain and then you're gonna differentiate what's going on there. So let's discuss it right now. Wait, let me put my spotlight. Okay. Okay. So I need you to be active also. So if I have question and then I ask you to answer also, so please type your answer in the chat box. So from the four picture like this one, you can imagine for dermatitis, for the lymphoma, and then this is for the mast cell, and then this is for the squamous cell carcinoma, which is this is typically okay. Let's say this is typically like benign, like just like skin inflammation. But how about the lymphoma? How about the squamous cell carcinoma? And how about the mast cell? Everything looks similar. And then what is the next one? The easiest way to diagnose, to get something, what's going on there, you just need your syringe and then you just need your needles. Because and then like you need the microscope. After you get the sample, you put it on your object glass, you put the diff quick stain, and then you check it under the microscope. Why? Because you want to know what's going on there. Sometimes like the colleague asks me, doctor, how about like the needle? How about the needle, the size of the needle? Okay, so you can use it like between 16 to 23 G. Usually the one that I recommend is like 22 because 22 is the best one. You can get it any sample, especially like to differentiate, is it like inflammatory or if it's like typical like cancer. And then what is like fine needle aspiration? Some people would mention it fine needle aspiration biopsy. Some people would call it like fine needle aspiration biopsy, but it's literally like typical. It's same. We want to get the cells, so we call it like cytology. So the indication, if you don't know what's going on with the mass, and then you just nick your magic needle, you just like hold the mass and then like you take your needle and then like stick the needle to the mass and then just take it from different side. So what's the function of the fine needle aspiration? So just to make sure, is it like typically inflammation or the neoplasia? So for the neoplasia, so you can tell it, is it like typically epithelial, mesenchymal, or the round cell? This is the thing for you. I do believe like for mm, my junior who's still in the college, it's still like uh you still have the long way to differentiate for this one. But like let's say the basic thing. Okay, if it's like neoplasia, usually the things that you need to think about. Okay, Dr. Steven, I think like this is like more cancer. So I think like I'm gonna think about, is it like epithelial? Is it like mesenchymal or is it like the round cell? Epithelials, usually we call it like carcinoma. And then the mesenchymal, we call it sarcoma. And then the round cell, we are going to discuss it next. As you remember, for every part of our body, we have like the cells. Our tissue, it's like built by the cells. Sometimes the cell is overgrown and then like the body just cannot compensate. If it's only like the benign one, usually you're gonna see it like a lump, warts, like something like that, or a mole. It's typically benign. But if it's like overgrowth and then they affect like the healthy tissue, so that's the thing that we need to consider. And then we need to find the solution for this one. And then like staging neoplasia, it helps. Let's say you want to take sample from the lymph node and then you stick your needle just to see what's going on there. Is there any spreadness from the mass that you suspect about? Like that one. And then the things that you have to remember for the fine needle aspiration is not a replacement test. You still have to go with the biopsy because the biopsy, you can imagine this is the cell, and then you just stick the needle. You just get only few cells. It's not like the whole part. And then like remember the terms like the bigger, the better result. So we want the big, we want to get like the whole picture. The advantages, it's cheap, fast, simple, non-invasive one, and then like yeah, you can get like some answer. Okay, what's going on? Is it like inflammation? Is it like cancer? And then there is the disadvantages, like okay, the sample is too tiny. You cannot review what's going on there. Okay, let's say this is cancer. You don't know what's great that one, and then like how bad the innervation, because you can imagine even though like the mass is only like small on the surface of the skin, sometimes like the root is like big behind it. And then like how do we know? You should ask your pathologist because your pathologist will tell you what's going on there. So literally, this is the mass. You prepare the needle. You just like put like, let's say this is my finger. It's like the needle, and then you just sneak it like this one, and then just like do like this to around the lump area. So at least you will get everything from it. It's same also like this one. Literally, if you want to use the syringe, it's good also. So this is the mass. If it's like only like raised a little bit, so you stick the needle, it's same. You just do all direction because we want to get like good and enough sample. And then after that, you take off the syringe and then you fill it with the air and then you spray it to your object class. After that, you can just do like impression like this one. Don't push it a lot. Don't push too strong because like it will make like the cell lyse easily. So just like slowly and gentle. Sometimes I love to use like okay, this is the needle and then they have like the cover. So I use like the cover of the needle and then like, I just like make it like spread to my object class. So at least I'm gonna know like what's going on, what cell is there. So the biopsy and the histopathologies. So biopsy, the indication like it's more accurate, definite diagnose for all tumor, and then like give you answer what's going on with the cytology. The advantages like okay, the sample is big, you can access all the tissue. It's more you're gonna get like definite diagnose, and then you can ask your pathologist to get grading. Remember, bigger is always better, but there is disadvantages also. So it's more invasive because you need to sedate the animals, you need to put the stitches, takes time for the healing, and then like yeah, usually like if you do only FNA, there is no like healing period. But like for the biopsy, you have to wait until the wound heals, like that one. There is also any possibility that you would not get any diagnosis if you do not get like proper sample. This is the thing that you need to make sure you're gonna get like good sample, like that one. Okay, this is like sample of the TCC, transitional cell carcinoma from the bladder. And then at the biopsy and the histopathology, a lot of technique that you can use. Usually you can use like the excisional and then the incisional. Excisional, it means like you just like remove it and then like you make like the excision. And then the incision, okay, you can use either like the punch biopsy, the wedge biopsy, needle core, and then the bone marrow biopsy. Let's discuss it a little bit. The needle core biopsy, it's literally like you use the things like here, the kit, and then you just sneak the needle to the lump, you push it, you press the button, and then like they will close it, and then they will trap the tissue in here. So usually this technique, you're gonna take like, let's say, I wanna get like good sample from the liver, from the lymph node, from the lung, and then like, okay, let's say this needle core biopsy is very useful for the biopsy for, let's say, like for the round cell, typically like round tumor, which is like, you can feel it, not like flat one. And then like for the needle core, better you take it like 3 to 5 sample in the area of the tumor. And then the punch one, the punch usually like it's for the superficial lesion because you will literally like to clip the hair and then like you want to see, okay, this is the lesion that I want to take. I just like use, it's literally like you punch with something, like press it and then you take it. So literally you put it on the position of the mass and then you press it, you're gonna get something because like it's typically like the blade is circular one. And then like the celerity for cytology, the things that you need to evaluate, is there any like the intact cells with minimum of the blood contamination and then like it's spread in the good monolayer area because like you want to know what cell is it and then like you want to know, is it like the cell is intact or not? Let's see. This is like the nice one. Okay, let's say this is the FNA that you get, you want to see, you're gonna expect like something like this one. And then this is the things that you're gonna hate because this is the cell, this is the round cell, this is the this is the nucleus, and then like you don't see any cytoplasma because why? Because you squash it like too strong. So you don't need like to squash it too strong because like the cell, you need to like uh take a good care of your sample unless like you're gonna see like something like this one. This is like typically lyse cells. And then like how do we differentiate between the inflammation and the non-inflammation? For every lump, for every mass, you have to think it first. Is it like inflammation or non-inflammation? If it's like the inflammation, okay, let's say, is it like suppurative, eosinophilic, granulomatous, lymphocytic, or the mixed one? Okay, let's say it's suppurative, so it means like mostly you're gonna love to see it will be like neutrophil, a lot of neutrophil. But how about like if it's like granulomatous? The granulomatous, like usually like you're gonna love to see like macrophage. There is still like neutrophil, but like it will be like more macrophage there. And as if it's like mixed pyogranulomatous, it means like you're gonna see like 70% like it's neutrophil, but like the rest, like you're gonna see like some few of the macrophage. Lymphocytic, it means like you have to find the lymphocyte, and then the eosinophilic, that you have to find the eosinophil from your cytology. So as you can see it here, you're gonna see like, okay, this is the neutrophil, and then this is like the with the cytoplasma, like with the granules, the red one. So this is like eosinophil. So you can see, okay, the eosinophil like it's increased, and then you can imagine from the one few like this one, you will know like, okay, the eosinophil is a lot. What's going on there? Is there any allergic? Is there any like bee stung or something like that one? And for this one, you can see this is like all with the neutrophil. You don't see any like, I don't see any like macrophages. It's more to the like neutrophil. So I can call this one like suppurative or purulent. And then like the right one below here, it's more to the lymphocyte. So I'm gonna call this like lymphocytic inflammation, like that one. So if you can see it here, The things for every cytology, okay, let's say you have to see the bigger picture. Sometimes like you're gonna see like, Dr. Stephen, what's going on the right upper here? What's going on here? What is this one? I don't know about this one. You don't need to know every single details. The things that you have to know, it's like you see the big picture of your cytology. What's going on there? Okay, from this one, I'm gonna say there is like inflammation there because I can say there is like inflammation. What is this, doc? This is the big one, but like mostly still like the inflammation. Okay, so we know it's still inflammation. So the big one, it's supposed to be the macrophages because the macrophage, like usually, like they can be like big, they can be like uh round, they can be like oval. It depends, like that one. And then, or okay, let's say I don't think it's like typically inflammation though. So is it like neoplastic? So let's see. So neoplastic, the things that you have to remember, there is like round cell, there is like spindle, and then there is like epithel. For epithel, the key point here is like you have to see that epithel love together by themselves. So you're gonna see like the beautiful cell that just like attached to each other. That's typically epithelial cells. But for the spindle, usually like it's typically because like it's typically of the spindle is like you're gonna see like the wispy tail. So you're gonna see like this is the nucleus, and then with the wispy like this one is typically spindeloid. But the things like for spindle cells, sometimes like they do not exfoliate well. Sometimes like yeah, it's not so easy to get the spindle cell. If you got it, like it's really nice, like you're so good. And the round cell, it's typically like you're gonna see it's typically a round cell. They don't like to attach each other. You're gonna see them like, okay, I can see this is the one cell, this is with the cytoplasm, and then with the border is very clear between one to other cell. So that's the thing that you need to remember. Okay, it goes back again. What is the most dominant cells if it's like cancer? Is it like epithels? Is it like mesenchymal, or is it like the round? The epithels, it's supposed to be cluster. The cells need to attach each other because that's typically epithels. Our skin built from the epithel. And then the mesenchymal or the sarcoma ones, usually they will be wispy tails. Wispy, you're gonna see it like looks like fibroblasts. Not gonna say like the mesenchymal if it's still like inflammation. I'm gonna think about the fibroblasts first. So I'm not gonna say like, oh, this is like the sarcoma if it's still like inflamed. That's the key. And then for the round cell, there is like 5 types of the round cell. There is like lymphoma, mast cell, plasma, histiocytic, and the TVT, transmissible venereal tumor. Don't worry, for you, for the first timer, this is like sounds like confusing, and then sounds like I do believe some of you would puke, like would get dizzy of this like kind of cell, but like yeah, it takes time to learn about this one, especially for you like still in the college. Okay, for epithels, usually like they are cluster and then they make a shared one. So, and then the mesenchymal, usually they are like individual and then like they are not clear for the margin of the cell. So you can see it's typically wispy. So you can see it here. Wispy, this is the nucleus. And then like you can see like the cytoplasma, it's more eclipsed like this one. And then they have the tail one. And then the round cells, as you can see, they must be like round, round. You can imagine this one between one to another cells, like they do not attach each other. And then for the round cells, usually like you have to remember, a round cell, they have like the 4 types. The histiocytoma, the plasmacytoma, the mast cell, and then the transmissible venereal tumor. How do we know how to differentiate? Let's discuss. For the round cell, usually, as you know, there is like, okay, you're gonna get the sample very easy. You just sneak the needle and then you're gonna get the cell because like they exfoliate very well. Some cells like will be like round, some cells will be like oval. So it doesn't matter as long as you know the margin is clear, it must be a round cell. And then like the between, like the margin between one cell to another cell is clear. And then the hints for the round cells is T lymph. T, it means like the T is the transmissible, the LY is the lymphoma, the M is the melanoma and mast cell, and then the P is the plasmacytoma, and the H is the histiocytic, like that one. Then how about like how to differentiate between this and another cell? Let's discuss after this. The things that you need to remember, round cell, they have like the abbreviation T lymph, transmissible federal tumor, lymphocyte, lymphoma, sorry. And then like the mast cell, plasmacytoma, and then the histiocytic. Okay, so the first hint, is there any granules or is there any vacuoles? If there is like granules and if there is like vacuoles, so we need to think if there is granule on the cytoplasma like this one, okay, we have to think it's about like TVT. But if there is like granules, I'm gonna think about the mast cell or the melanoma, but I'm gonna see what the color of the granule. If it's the purple, it must be mast cell. If it's the black one, it must be melanoma. Okay, let's say if there is no granules, if there is no vacuole. So what's for histiocytoma? Because the histiocytoma is typically round cell, no granules, no vacuoles. The cytoplasma here is like pale gray. And then you're gonna love this cell because this cell is so beautiful. And then they looks like fried eggs. And then the plasmacytoma, okay, let's say, Dr. Stephen, I do not see the I do not see the granules and then the vacuole. So I'm gonna delete for the mast cell, TVT, and then the melanoma. So the rest is only histiocytic, lymphoma, and then the plasma. Histiocytoma, you're gonna know the cytoplasma is like pale gray to blue. But like how about the plasmacytoma, which is like this one? It's typically round, no granule, no vacuoles, but the cytoplasma it's more deep blue. It's more black. And then sometimes you're gonna see the flame cells, and then the perinuclear zone is clear. Perinuclear, it means like the nucleus, they have like something white. We call it like the perinuclear. It's like typically of the plasmacytoma, and then the nucleus it's more eccentric. Eccentric it means goes to the edge of the cell, so it's not typically like on the center of the cell. Okay, we know already histiocytoma, plasmacyte, and then how about the lymphoma? The lymphoma is typically round. You're not gonna see the granules or the freckles, but you can see it between three of these. The nucleus is the biggest because it's characteristic typically of the lymphoma. And then there is like nucleoli also. This is the nucleus. This is the nucleoli. So you're gonna see it here. This is typically of the plasmacytoma. You can see the nucleus is like typically goes to the edge of the cell, eccentric one. This is typically TVT. There is like vacuoles, and then this is like typically mast cell because they have the granules here, so you cannot see the cytoplasm because like it's the purple granules that cover. And then this is typically histiocytoma, but this is like I can say like this is like not as beautiful as the normal one. It's a little bit bad, sorry. So for this one, uh, if you can help me to differentiate, is it like more inflammation or is it like more the cancer? You can put in the chat box. I'm gonna give you like 10 seconds. Let me check the joining. Where is the chat box? Okay. There's no one who wants to help me to answer for the chat box. Is there any cancer or is there any like more inflammation? It doesn't matter. It's not like exam. Okay. Good. Cancer, cancer, cancer. Yeah, that's good one. Okay, so it is like typically cancer. Yes, correct, because you don't see any inflammation there. What you want to see only like the cells. Okay, from all of this one, which one do you think? Is it like, let's think about the easy things. If it's cancer, you need to think about the epithels, mesenchymal, or is it the round? Which one do you think? Is it like you can see them like, okay, you need to think, is this like round or is this like the wispy? Please help me to answer that one. Okay, round, round, round. Okay, good. Mm, 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 mm. Okay, there some of you said round, some of you of said like carcinoma. Carcinoma, it means epithel, but as you can see, as I told you, like round, typically they don't tend to attach each other, but as you can see it here, so they tend to attach of each other. So you can see like all of them, like they attach each other. This one cell attached to this one cell, attached to this one cell. So it means it's typically carcinoma. And then especially if you still remember of the histology, so you can see this is like typically acinar structure of the epithel. So you can see if beautiful like on the edge. It's typically of the epithel's origin. It's good. Okay. There is like another cytology also. Let's zoom. Okay, how about this one? Is it like inflammation or is it like the cancer? 10 seconds. Please help me.
Cancer.
Okay, good. Cancer, good. Okay, from the cancer, please help me to tell. Is it like epithel, mesenchymal, or the rump?
Mesenchymal.
Okay. Hmm?
Mesenchymal.
Yes. Okay, let's say some of you like is still like, I'm not sure, doctor. Is it like the inflammation or is it like the cancer? Okay. From the big picture of this one, which one do you think is more, I mean, like more obvious? Okay, let's say if you just blink your eyes and then like, what is the most cells that you're gonna notice? Is it like the inflammation or is it like the obvious cell, like the I don't know what's going on with the cell? What do you think?
I feel like it's more self than inflammation.
It's like more like weird cell, right? Like
Yep.
I don't know what's going on with this cell, but I think it's like it's more like something going on, like something's going on there. Okay, let's say if it's like more cancer, then I need to think, is it like typically epithel? They don't tend to close to each other. Is it like round? But I don't think it's round because like I cannot see like the margin, like it's not clear margin because the round you have to see about the round circular. Okay, let's zoom the next one. How about this one? After we zoom in, is it, do you think still it's epithel? Is it like mesenchymal or I think like it's more round cell? 10 seconds.
Maybe mesenchymal.
Others? try to guess. It's good. For me, I will not think about the round because like it's not round. So it's either epitel or mesenchymal. But if I see the epitel must attach to each other, but this one what you can see, this is the cells. It's kind of like wispy one, elongated. This one also. So this must be like mesenchymal. And how about this one? Is it like inflammation? Okay, let's think the first step. Is it inflammation or cancer?
Inflammation is
Okay, let's think. Is it like inflammation or cancer? Inflammation, the things you have to see. Is there any a lot of white blood cell, neutrophil?
if there is neutrophil.
There is, okay. There is, okay, I agree. 1, 2, 3. Yeah, this is not. This. But in your opinion, is it more white blood cell or more another cell that you don't know? Let's say another cell that you don't know. Yes, it's typically the other cells that you don't know. Okay, let's see. You know this must be not inflammation. Okay, then it means from the neoplastic cells, what's the thing that you need to think? Okay, so it means right now you have to think about the either epithel, mesenchymal, or the round cell. So which one of these? It's good one. It's good one. It's not inflammation, but it's more neoplastic or cancer. Okay, good round. Good answer. So you know it. It's typically beautiful round. It's typically like wow. It's so like like between one to other cells, like it's typically okay. This is must be like round. I see it round here. Okay, for the round, there is like abbreviation that I put there. The T lymph. So it means the transmissible lymphocyte, mast cell, plasmacytoma, and then what else?
Histiocyte.
Histiocytoma. Nah, from you, from this picture, is there any granules or is there any vacuoles on the cytoplasm?
There is an vacuole in cytoplasm.
What?
Vacuole.
Is there?
Vacuola. There
Is
is
there?
vacuola.
Is there? Is there?
Vacuola.
Is there any vacuole or not? Yes or no?
Yes.
No, I don't think there's any vacuoles. So you can take a look here again. The vacuole, it means must be like uh, bubbles on the cytoplasm. Is there any granules? Is there? Okay, the easy way, let's say like this one. What is the correct okay, if I say there is like any granules, so what cells do you think is from the round cells that has the granules?
Mast cell tumor.
Yes, and then
Histiocytic.
no, histiocytic, they don't have any granules. Mast cell and then melanoma. And then how about the vacuole? What cells do you think from the round cell?
Lymphoma.
No, it's TVT. But for this picture, okay, let's say there is no granules, there is no vacuole, so I will eliminate like for the mast cell. I'm gonna eliminate for the TVT, so there is only 3 left: histiocytoma, plasmacytoma, and then the lymphoma. So in your opinion, how about the position of the cell? Position of the nucleus. Is it like on the center or it's more eccentric? It means like goes to the edge. Or you think like the nucleus it's a little bit big? So the nucleus here is a little bit big. You can see it's big like this one. It's typically of the lymphoma. Then how about this one? Do you think it's like inflammation or cancer? Yes, cancer. And then like from the cancer, is it like round epithelial or mesenchymal? Is it round
It's more round.
epithelial? Okay, round, good. So from the round, do they have granules? Do they have any vacuoles?
I think they have granules.
Yes, granules correctly. So it must be what? The granules is purple.
Melanoma.
Mast cell, because the melanoma is more black. And then how about this one? Is it like inflammation or cancer?
More like cancer.
Okay, cancer, good. And then for the cancer, is it from epithelial or mesenchymal?
Epithelial.
Is there another answer? I don't think it's epithelial one. It's more round because like between one cell to other cells, like they don't attach to another. And then for the round cell here, so you can take it like, okay, for the round cells, like you have to think, okay, is there any granules or is there any like vacuoles?
More like vacuole.
Which one part of the vacuoles that you see? Because this is the cytoplasma is clear, there is no vacuoles, there is no granules. And then like the nucleus, it goes to the eccentric, and then the things that you need to think, there is like flame cells here. This is typically of the plasmacytoma. This is the flame cells. Sometimes like you will think about like why it's not as easy. Why you don't think it's another one, doctor? Like yeah, it takes time for you because like this is the things like okay, you need to see it like from the whole picture. Okay, I noticed there's like flame cells here. Okay, that's like typically plasmacytoma. Then how about this one? Inflammation or cancer? Yeah, good. Cancer. And then what cancer? Run, good. And then run, what is the most suitable one or this one? Is there any granules or vacuole?
No, there is no.
Okay, there is no granules and vacuole, so I'm gonna delete the mast cell and then I'm gonna delete for the TVT. So it's only like histiocytoma, plasmacytoma, and the lymphoma. So do you think like the cell, the nucleus is like on the center or more to the margin or more
More
eccentric?
like in margin.
Yes, on the center, right? It's more on the center here. And then like the nucleus also, the size like is not that big. So this one is beautiful also. This one is like typically the histiocytoma.
It's still something.
And how about this one?
TVT.
Hmm? Is it like
TVT.
cancer? Okay, TVT,
Yes.
transmissible venereal tumor. Because it's typically around cells, they have the granules. This is the things that I mentioned. This is the granules that you have to see. If you notice, this is the granules, like, and then these typically round cells, like it's typically like TVT. And then like cytology depends on the pattern of recognition, guys. And then, okay, let's say you know it's typically cancer, and then what's the next step? You have to tell the owner. I think like it's more malignant or it's more benign. So that's the thing that you have to discuss. Okay, if it's more malignant or if it's not more benign, at least when you remove it, better you apply the wide margin of the surgery just to remove it. And then how do we know? Like if it's like typically malignant or not? So you can see the size of the cell. Is it like big and small one? If it's more big and small, it means like anisocytosis, like a lot of cell size. And then like it's more pleomorphism. So it means like a lot of small, big cell, small, big cell. So it's more variation. So it's typically pleomorphism. And then the cytoplasmic basophilia, it means like there is like this it's not like the gray beautiful, but it's more black. And then like this is from the cell one, but how about the nucleus? So the things that you have to see, the cell itself and then the nucleus, because the nucleus, the things you have to see, how big the nucleus. Let's say there is like small nucleus and then the big nucleus. Okay, so we know it's something that growing. And then there is like multinucleation. So nucleus is like dividing into like more than one. And then nuclear atypia, mitotic figures, nuclear molding. Let's discuss it, this one. So as you can see it here. So typically, let's say the easy way. The cell, there is like the big one, there is like the small one. And then like you can see, this is very big cells, this is very small one. Okay, let's see. Dr. Stephen, I noticed this one. This is one cell, but it looks like they have like the nucleus and then they have like something small here. It is like nucleolus, so it is very dividing cells. So it means this cell is actively like growing. So you can mention to the owner, yeah, this is like typically like not a good sign of cells because like they are growing. Then how about this one, Dr. Stephen? Okay, let's say with the Stephen, this is like the small, this is the big. Okay, so the cell is growing. And then what else that we can see? Let's see what I can see it here. Okay, there is like, you can imagine this is like a cell with the nucleus, and then there is like nucleoli in here. Okay, it's more malignant also. And then if you notice it here, you can see in one cell, there is like this is we call it nuclear molding. So it means like the nucleus is starting to divide because once like this nucleus is dividing, so they will grow and then like they will make like the new cell. So you can see it. It's beautiful. And then one cell, they have two nucleus. And then this one is actively like molding. And then this one also you can see. In your opinion, is it like more cancer or more inflammation?
More cancer.
Cancer or inflammation?
Cancer.
Please see the whole picture. Is it like inflammation or cancer?
Cancer.
Sure? It's like multinucleated giant cell. It's like typically inflammation because you can see like from the whole picture. Okay, there is like big cells. Yes, I agree with that one, but I will not think about it because mostly here I'm gonna see there's a lot of neutrophil here. Neutrophil, but neutrophil is like this is typically toxic neutrophil because like they fight already and then like you can see the neutrophil start to get like more swollen. This is like typically toxic neutrophil. It's from the inflammation. So it must be the big one is the multinucleated giant cells. It's typically of the macrophages. And then this is like example of the osteoclast. And this is the megakaryocyte, which is like typically abnormal cells. And then let's learn how important cytology. Okay, first case, Anicha. It's 1 year female French bulldog. Uh, she has this lesion. Sorry, she had this lesion like 10 days before admitted, and then it's getting bigger. It's bright, alert, and responsive. Okay, as you can see it here, it could be dermatitis. It could be like the mast cell. It could be like the squamous cell carcinoma. It could be like the lymphoma. So I took like the cytology. So what do you think about this one? Is it like more inflammation or it's more cancer? What do you think? Wait, I'm gonna see the chat box again. Sorry. Oh, yay! Okay, inflammation, good one. So it's correct. It's more inflammation because you can see it here. This is like the inflammation, and then like move it. Inflammation. Okay, I see like there is something few cells that I don't know, but like it doesn't matter because mostly from this one is inflammation. Inflammation or cancer here. And now with only like treatment, like it's good. With only like the antibiotic, anti-inflammation, it heals. You can imagine if you do not aspirate, if you do not do cytology, you would think about this one is cancer. And then what is your expectation? Will you suggest the owner, okay, let's cut the nose? You can imagine Frenchie, if you cut the nasal planum, what will happen? It will be like the small Voldemort without any nasal planum. So the easy way, the cheap, the non-invasive, without any surgery, without any sedation, just stick your needle. That's it. The second one, Nana, 8 years, like female mixed dog, and with the submandible. So the lymph node like under the mandible is enlarged. And then this is what I got from the FNA of the submandible lymph node. So do you think what kind of cells? Is it like uh epithelial?
Cancer.
Is it like mesenchymal or is it the rock? Hmm. Are you sure with the inflammation? Is there any white blood cell? Okay, go on, go on.
It's epitel cancer, maybe.
Inflammation or cancer?
Cancer.
Okay, if it's cancer, what kind of epitel, round or mesenchymal?
I think it's epitel.
Yes, because this is the epitel one. So you can see it. Just remember, if it's only inflammation, you have to see the beautiful neutrophil. Is there any neutrophil or not? If you do not see like a lot of neutrophils, just ignore it. So it's only like the naughty neutrophil just go to your place. But from this picture, it's more to the cancer one. Okay, if it's cancer, I need to think, is it like the epitel, mesenchymal, or the round? But from this one, I know this is something that they love to attach each other. This one also, this one also. So I'm gonna think about the epitel, which is from the lymph node. Lymph node is like just the barrier from the body. So if something happen, like if the pathogen goes in, so they will produce the cell. It's called lymphocyte. This is the typically of the lymphocyte. But this one, there is an epithel inside the lymph node. So is it normal, do you think? So you know the lymph node is same with the police station. You have to see the police officer, but you do not see them, but you see the nurse is there. Is it normal? And no, it's not normal. So you have to think, you have to figure out what's going on. You have to check. When we check the oral cavity, you can see there is like oral mass and it's spread to the lymph node. And then like we decide to let Nana go, like euthanize. And then lady 10 years female golden retriever. It's same with the mass here. So what do you think? Like it could be dermatitis, it could be mast cell, it could be SCC, squamous cell carcinoma, it could be lymphoma. So we did FNA and we noticed this one. What do you think? Is it like more cancer or inflammation?
Inflamed.
Is it inflamed? Do you see
Yeah.
any? Do you see any like inflammatory agent?
Oh, actually, no. It's
Okay,
cancer.
so it's cancer. What kind of cancer? With the obvious one.
Round cancer.
Huh? There
Round,
is like
round cancer.
this one. Yeah. This is like typically granules. With the black granules one, it's melanoma. Yeah. This is typically of melanoma. Unfortunately, like lady passed away because like uh it spread to the lung already. It's too late. Wait, I'm gonna show you like the picture of lady. Mhm. This is lady last time. I'm gonna show it to you. Wait, please wait a moment. So when you tell the owner there is like melanoma, and then you can tell them like, okay, there is like something that you need to tell the owner, so at least they will know. Okay, uh, my dog is having like difficulty, is having like the issue, so I need to do like quick action, unless it will be like useless. Because like literally like after like I did my cytology and then I tell the owner, this is very, very aggressive one. And then we need to think fast. We need to cut the nasal plenum because literally like I suggest to cut the nasal plenum, but the owner like doesn't want to cut because like they are so afraid about like, okay, my dog will be not good until few months later, like it spread to the lung. So you can take a look here. So wait. Okay, you can see this is all the metastasis lesion. And then the worst part, where's the most one? You can imagine this is like so big already. So big here, big here. And then you can see the gum spread to the gum, which is like before, it's very like happy though. So that's why. And then like we diagnosed like on 16 August, and then it spread on October, 2 months later. Sorry, it spread like totally spread like on December. This one. Yeah, that's all from me. So feel free if you have any question for you who is still in the college, and if you want to do internship at our hospital, feel free to come and then you can let me know. Thank you.
Yeah, thank you, Dr. Stephen, for the amazing presentation. Now the students can differentiate the inflammation and neoplasma, yeah, knowing what kind of type of cancer, what kind of like epithel or mesenchymal or round cell, yeah.
Yes. I
So
do believe like it's quite tricky, but like yeah, if it's very helpful.
okay, so this new knowledge, yeah, about the cytology is new for the students because in the clinical pathology or in another lecture, they haven't got this kind of topic, yeah. So now is the time for the Q&A session. Maybe there is a student who wants to ask a question to Dr. Stephen related to today's guest lecture topic. Please raise your hand and turn on your microphone. Yeah, Sasi. Please. Sasi. Yeah.
Okay. So can you hear my voice? Sorry. Can you hear my voice?
Yeah, but it a little bit unclear because of the noise.
Okay, sorry.
Yeah, okay, it's okay now.
Okay, thank you very much.